So my name is Dr. Lauren Tomlinson, and my PI is Dr. Joseph Cheever. My research project is titled Analysis of Overall Orthodontic Treatment Time when Using LightForce. It is a literature review. So I'll start off by just briefly going over the introduction, kind of what LightForce is. We'll discuss an objective, and then I will list my methods. My research project is ongoing, is not yet completed, but this is all that I have thus far. So without further ado, the first prescription orthodontic bracket was introduced a little over 40 years ago, marking a significant advancement in the field of orthodontics. The evolution of the prescription bracket evoked a different way of thinking. Movement of teeth was no longer solely dependent upon bending wires, but relied more so on the ideal placement of brackets and the expression of the prescription embedded in them. This improvement allowed for better control of tooth movement in all three planes of space. Treatment, however, was still not fully customized to each individual patient. Bracket systems were and still are somewhat generic, with stock prescriptions that essentially utilize a one-size-fits-all approach. As technology continued to evolve, one breakthrough of the late 20th century was the invention of the 3D printer. This advancement in technology allowed customization in not only medicine, but dentistry as well. After years of extensive research with 3D printing, Dr. Alfred Griffin III introduced LightForce Orthodontics in 2019. This breakthrough brought about the first 3D printed ceramic bracket that could be digitally designed and fully customized to meet the specific needs of each individual patient. This next level customization allowed brackets to be flawlessly designed and perfectly placed from the start, thus eliminating the need for bracket repositioning and ultimately shortening the duration of treatment time. This literature review will assess the efficiency and effectiveness of the LightForce bracket system and compare overall treatment time to traditional prescription bracket systems that are still widely used today. So that was just a little intro. So now we're going to move on to the objective. So the length of orthodontic treatment is one of the major factors in determining the success of a patient's final outcome. For most patients, any treatment time longer than anticipated in full fixed appliances, or braces, right, can negatively impact oral health. As treatment time increases, compliance and motivation tend to decrease. Improper brushing and flossing techniques greatly increase the risk of poor oral hygiene, ultimately leading to gingivitis, periodontal disease, and sometimes decay. The objective of this literature review is to investigate if LightForce is an effective and efficient treatment option that does in fact reduce overall treatment time. Finishing treatment time in a timely fashion would be beneficial for not only the patient's oral health, but their overall well-being. And then the methods. So I did a literature search. It was conducted utilizing the following databases: PubMed, Scopus, and Google Scholar. The search included the following keywords: LightForce orthodontics, 3D printed customized brackets, and LightForce treatment time. Peer-reviewed articles containing information on the efficiency and effectiveness of the LightForce bracket system, along with duration of total treatment time, were considered eligible for review. Search results are currently being studied, analyzed, and summarized accordingly. So I'm still in the early stages, if you will, of this research project. And yeah, so this is all I have thus far. I'm excited to see if in fact this newer approach, newer orthodontic system does in fact reduce your treatment time, and that would ultimately mean, world win for the patient. So yeah, thank you very much.